What should people be thinking about when they're thinking of what's right or wrong with Obamacare?
Right. Well, this is 2013. We can do amazing things with computers, and I think it's only a matter of time, only a matter of taxpayer money that we can throw at the computer problems, the traffic, the servers, and the software. Eventually, I believe that those things can be fixed. We can manage millions of people signing up for something online. Look at Facebook. Look at these other forms of websites that do just that. But what can't be fixed about Obamacare is the economic incentives are so skewed, and the approach that it takes to lower premiums through subsidization and through moving people onto Medicaid, that's a really flawed approach because ultimately it confuses health coverage with health care. There's a mismatch between supply and demand that will be Obamacare's reckoning day.
Let's get into that. You mentioned in this column that that is a problem with people equating health insurance coverage with an actual improvement in health care, and these are two entirely different things.
Right. There are a lot of measures that get confused when we talk about international rankings. We hear people point out time and again that the United States is 38th, 39th, 40th in universal health rankings, and those rely on a lot of different health indicators. They rely on, how many low-weight births we might have or what kind of infant mortality measurements we use. And so some of those we ought to look deeper into those statistics. But importantly, in the United States, we have some things going for us. We have some of the best cancer survival rates in the world. The World Health Organization ranks us as #1 in responsiveness to the needs of the individual patient. Those are things that we ought to keep in mind and protect as we do health reform while we look at some of the problems we have in payment and in cost. So yes, we have a complex multi-party payer system. There's not a lot of transparency in the decisions that we make as consumers. But when we have a card from our insurance company, or we have a card that says we're enrolled in Medicaid or Medicare, that's not the same as being able to pick up the phone and call a physician and make an appointment. Actually, we've seen that about a third of primary care physicians say that they're not going to take any new patients who are enrolled in Medicaid. Is that really the same thing as healthcare access when we talk about health insurance coverage? Access means being able to make a timely appointment, have your health care given to you from a physician or a healthcare provider of some kind. That's not the same as having a piece of paper. So far in the United States, it's been very similar because we do use our health insurance to access or to make an appointment, to get, put on a list for transplant or whatever it is that we need. But in the future, I wonder, because we are facing what will be a tremendous shortage in the supply of physicians, we have many more people with a demand because they'll be newly insured through Medicaid. What is going to happen when people call and say, oh, I'm sorry, you can't get an appointment for months? That's a very serious question that Obamacare doesn't answer.